My name is Christina Perkins. I'm a student nurse at the University of Southern Mississippi, and today we're going to be inserting your nasogastric tube. So if you could just tell me your name and date of birth. Okay, and do you have any allergies? No? Alright, I'm just going to confirm this with the MARS, and this is the correct order for this patient. And then we're going to begin. The nasogastric tube is a tube that's going to be inserted into your nose, and it's going to go directly into your stomach for feeding and administration of medication. So now we're going to begin on perform hand hygiene. And put on some gloves. And drape this over the patient. And could you include one nostril? Okay, and the other one? Breathing seems to be better in the right nostril, so that's the one we will be inserting the tube into. So first I'm going to measure the tube, starting at the tip of the nose to the top of the ear, and then down to the xiphoid process. All right, and then we're going to mark this area with a piece of tape. All right, and then I would also lube the tube 2 to 4 inches. Okay, and now I'm going to lift the bed into a high Fowler's position. And all right, and now we're going to tilt the head back and start inserting the tube. Just take some deep breaths. Okay, and now we're going to tilt the head to the chin to the chest. Okay. Now we're going to secure the tube with 2 pieces of tape. And then another piece of tape over the bridge of the nose. And then during the procedure, if there was any signs of gasping, cyanosis, we would discontinue the procedure and take out the tube immediately. And then we're also going to order an x-ray to make sure that the tube is in the correct placement. And also we could check aspiration and check the pH level of the contents. And now we're just going to secure the tube to the gown. Alright, so now I would come back in and we're going to administer medication. I would check the patient's name, make sure it's correct on the order and that this is the right medication. So now we'll begin. First we're going to flush the tube with 30 milliliters of water. Okay. Then we're going to take this out. And administer the medication. And then flush it again with 30 milliliters. And place this down once again. Then we're going to come back in and take the tube out. We'll just confirm once more that this is the correct patient and that this is the correct procedure today. And so now we're just gonna begin by removing the tape off of the nose. Okay, and then so take a deep breath, and this is going to be 1 slight motion. So now we'll just make sure that the patient is comfortable, lower the bed and make sure it's locked, and then we'll put the call light on the bed. And do you have any questions? Alright, if anything happens, you can just hit the call button. Alright, thank you. And now I'm going to go ahead and document this procedure.